Hello guys, welcome and welcome to Meteor Academy. And the good news is we are going to launch our new branch in Pondicherry from August 14 onwards. So utilize the opportunity and train yourself for upcoming competitive exams. We, the Meteor team, are always ahead in training the nurses in their competitive exam as well as IELTS and OET training, and also we are doing abroad nursing placement services. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. And today the session will be on Community Health Nursing Part 2. Are you ready? Let's begin the session. The first question is, a mortality indicator among the following is disability rate, prevalence rate, incidence rate, life expectancy rate, or life expectancy at birth. And here the correct answer is option D, life expectancy at birth or life expectancy rate. This is a direct question. The next one is, most significant health status indicator of a community is. Options are life expectancy at birth, disability prevalence, resource available, psychosocial development of children. And here the correct answer is option A, life expectancy at birth. The rationale behind this is life expectancy at birth reflects the overall mortality level of a population and it's a positive mortality indicator. The next one is, if the number of deaths from dengue is expressed in relation to the total mid-year population, it is. Options are age specific death rate, proportionate mortality rate, case fatality rate, cause specific death rate. It is a direct question and here the correct answer is option D, cause specific death rate. The next one is, which of the following rate is applied to calculate the total number of deaths occurring in a hospital after 48 hours of admission? Underline the word after 48 hours of admission for a period divided by total number of discharge for the same period in the hospital into 100. It is called as, the options are GDR, NDR, BTOR and BOR. Here the correct answer is option A, GDR, gross death rate. You should know the abbreviation first. Let's see in detail. GDR, gross death rate, is equal to total death in a period divided by total discharge into 100. On the other hand, net death rate is equal to a death rate also known as institutional death rate that does not include the death which occur within 48 hours of admission. Underline the word. The next one is bed turnover rate, that is called as BTOR, average number of patients cared for a bed during a given period of time. Okay. The next one is BTOR, the further explanation about it, number of discharge including death for a given period of time divided by average bed count for that period of time into 100. So this is the formula to measure the BTOR. And the last one is bed occupancy rate, BOR, the average occupancy of beds in percentage. It is the ratio between the bed used and bed provided. So this is how we selected the answer. Expectation of life free of disability is known as Parkes Index, Smith's Index, Sullivan Index and Life Index. And here the correct answer is option C, Sullivan's Index. So Sullivan Index means the life expectancy minus duration of disability. Life expectancy means how long the person lived. And duration of disability means during his lifespan how long the person had the disability. If you minus these two, you will get Sullivan's Index. The full form of DALY in the context of community health is. Options are disease adjusted life years, disability adopted life years, disease adopted life years, disability adjusted life years. And here the correct answer is option D, disability adjusted life year. The rationale is DALY is the number of years lost in the health life of an individual due to disability. Because of disability, how long the person lost his healthy life, that is called as DALY. How to measure this? DALY is equal to year of life plus year lost to disability. And one DALY is 1 year of healthy life. The next one is, which of these is not a part of vital health statistics? Options are live birth and fetal death, marriage and divorce, death and teen pregnancy, delinquency and crime rates. It's a direct question, and here the correct answer is option D, delinquency and crime rates. The next one is, which of the following is not a vital indicators for health? Morbidity indicator, disability indicator, mortality indicator, health policy indicator. And here the correct answer is option D, health policy indicator. First, we should know the rationale about vital indicator and behavior indicator. What is vital indicator? It includes mortality indicator, morbidity indicator, disability indicator, service indicator and composite indicator. Whereas behavioral indicator include health policy indicator, indicator for the provision of healthcare, health status indicator. So if you know these types of indicators, then we can directly switch to the answer. The next one is, all of the following are vital health statistics which determines community health status except. Options are death rate, birth rate, life expectancy. Please do the correction. It is not LEDE expectancy. It is a life expectancy. And migration rate. And here the correct answer is option D, migration rate. The rationale behind this is vital health statistics, which includes the indicator like birth rate, death rate, natural growth rate, life expectancy at birth, mortality, morbidity, marriage, divorce, fertility rates. On the other hand, migration rates is a social indicator of a country, and it is based on social, politics, cultural, environmental, health and educational factors. So these two things are totally different. So that's why we selected the option migration rate. The next one is, health promotion includes the alleviation of physical symptom, causative factor, illness, physical symptom and causative factor. And here the correct answer is option D, physical symptom and causative factor. The rationale is, health promotion is the process of enabling people to increase control over and to improve their health. And it is achieved by health education, elevation of causative factor, behavioral changes, life change and nutritional intervention. Health illness continuum and high level wellness model demonstrate. The options are importance of family, wellness as a passive state, health as a dynamic state, illness as a fixed point in time. And here the correct answer is option C, health as dynamic state. The rationale behind this is, according to health illness continuum and high level wellness model, health of an individual is not static but it is a dynamic state. Underline the word dynamic state, which changes continuously from positive health to ill health or death. That's why we selected the option C. The next one is, the agent host environment model of health and illness is based on the concept of stages of illness, infectious disease, prognosis, rate of exposure. And here the correct answer is option B, infectious disease. The next one is, the agent factor responsible for occurrence of a disease includes except. Options are biological and physical agent, mechanical and chemical agent, vertical and inoculation agent, and the last one is nutrition and living agent. And here the correct answer is option C, vertical and inoculation agent. The rationale is, the agent factor responsible for the occurrence of disease includes, first one is biological, which includes bacteria, virus, fungi, etc. all living organisms. Next one is nutrient, which includes carbohydrate, fat, protein, etc. And chemical, which includes two things, external agent like lead, arsenic, and internal agent like urea, bilirubin, ketone, which is formed inside our body. Mechanical like accident, death, any injuries. Social like poverty, smoking, etc. The people at risk approaches are something for all, more for needy, all for same, all for all. It is a very easy and direct question, and here the correct answer is option B, more for needy. The rationale behind this is, at risk approaches means identifying and devoting more care to individuals or groups who are all at special risk. For example, pregnant woman, infant, chronically ill patient, handicapped and elderly patients. The next one is the ability of an organism to include clinically apparent illness is called virulence, etiology, infectivity, and pathogenicity. So listen to the question carefully. The ability of the organism to induce clinically apparent illness is called as option D, pathogenicity. The rationale behind this is pathogenicity is the potential ability of an organism to produce the disease, only to produce the disease. Virulence means the power and degree of pathogenicity in an organism, how strong the disease is going to be within the patient body. Infectivity means the ability of an organism to establish an infection, how it is going to infect him as well as others. The next one is an infection which is present in an individual but not sufficient to result in a disease is called as. Options are latent infection, subclinical infection, clinical infection, secondary infection. And here the correct answer is option B, subclinical infection. So let's see the rationale. An infection that is immunologically confirmed but host is not producing noticeable signs and symptoms is called as subclinical infection. And the next one, an infection which is obviously observable and detectable symptoms is called as clinical infection. The last one is an infection that is hidden and does not shed the infectious agent which lies inactive or dormant, underline the word, which lies inactive within the host without symptom is called as latent infection. Next one is transport host is one which parasite passes its sexual stage, parasite remain asexual, organism remain alive without doesn't undergoing development, and D is life cycle is not complete. Here the correct answer is option C, organism remain alive but does not undergo any development. The rationale behind this is there are different type of host. The first one is transparent host, a carrier in which the organism remain alive but does not develop, underline the word, does not develop. Definitive host means the parasite goes through its sexual cycle. Intermediate host, the parasite replicates but does not go through its sexual cycle. Reservoir host, the parasite resides in the host without ill effects. Next one is the concept of one-to-one relationship between agent and disease is explained by germ theory of disease, multifactorial disease causation, epidemiological triad, web of causation of disease. And here the correct answer is option A, germ theory of disease. The last one is which of these theorists view health as a synthesis of germ theory? Biomedical, ecological, sociological, and holistic. And here the correct answer is option A, biomedical. The rationale is biomedical model focus on disease as a result of malfunctioning of organs or cells. Example, diabetes, it is a disease and it is caused by malfunctioning of pancreas. That's why we selected this option. I'm ending the session, guys. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon and share the videos as much as possible so that everyone will get utilized from it. And if you want to contact us, you can contact us in the given address given below. And thank you very much. If you have any question anywhere, please drop your message in the chat box. Keep reading and keep getting succeed.